In various medical fields within healthcare, we are facing an astonishingly serious problem. We are drowning in heterogeneous patient data while starving for expert knowledge for interpretations. Computer science researchers are assisting medical practitioners in the detection, diagnosis, and treatment of various medical conditions. They combine human intelligence with artificial intelligence by building computational models for the big medical data that is available.
Content-based image retrieval is a method of using information in the image itself. Information such as color, contrast, edges, those types of features for storing and retrieving images. And it's a potential solution to the problem of ever-increasing amounts of digital images and the fact that most of these images are not annotated. That is, there hasn't been somebody to add labels or tags to those images. And in the biomedical area, one of the major uses is to be able to retrieve similar images, for teaching, for research, for diagnosis. Our current dermatology project is to extend the traditional content-based image retrieval for what we're calling human-centered CBIR. And we're using a couple of different techniques to try to elicit domain knowledge from our expert dermatologists. We're doing eye tracking and also having them do verbal annotations as they're describing these images. The intent is to model the data and to somehow bring all those multimodal types of data together to better organize the images in new types of databases.
To represent the expert's perception of key image features, they develop models to decompose eye tracking data into several behavioral patterns. To represent the expert's diagnostic reasoning processes based on the images, they also modeled the expert's verbal narratives. This is achieved by developing hierarchical dynamic models. Additionally, to group the medical images, they also develop an interactive machine learning paradigm where the user inputs are encoded as special constraints.
The current medicine practice heavily rely on the empirical evidence of patients' symptom data and the experience of physicians. In the CBL, we are interested in developing and using AI technologies to better analyze the variety of data available from a person and use that to derive personalized solutions to support the care for cardiac disease and health.
They develop and use various Bayesian models to disentangle the important electrical signal sources inside a patient's heart from their ECG data. To incorporate new patients and tackle the challenge of inter-patient variations in electrocardiogram data, they develop variants of deep learning models. These variants can be used to localize the problematic electrical circuit that causes heart failure. They use machine learning methods to predict the risk of sudden cardiac death in patients with cardiomyopathy.
For behavioral problems such as suicide, drug addiction, and job stress, social media provides data that is in many ways qualitatively richer than those coming from techniques like focus groups, but at a volume greater than that of any survey, at much lower costs, and with a social context for free. The sheer volume and irregularity, however, of social media data requires machine intelligence to make sense of it. But the human stakes involved require human intelligence to guide it, and that never comes cheaply, even as crowdsourcing provides new and seemingly cheaper mechanisms for doing so. We study novel methods for making the best use of human intelligence in machine learning settings, where the data is semi-structured and the problems involve human social welfare, particularly among vulnerable communities. Our results reveal narratives about intimate partner violence and job stress, and reveal the social support structures present in LGBTQ youth, urban communities, and access technology movements, all discovered within vast amounts of social data. Our work involves public medicine research, particularly around biopsychosocial theories of how people use social media to augment their informal health support resources.